Hi, my name is Dr. Medha Satyarengga. I am an endocrinologist at the Center for Diabetes and Endocrinology at Shore Regional Health. I see patients in Easton, Chestertown, and Denton. So endocrinologist is a physician that specializes in treatment of hormonal conditions. We're best known that we treat diabetes because diabetes is a condition where you have issue with your insulin, which is just one of many hormones in your body. However, you have other hormones in your body, for example, thyroid hormone, adrenal hormone, sex hormone, and then a parathyroid hormone. All those hormones, when you don't have enough of them or you have too much of them, can cause medical issue. Other than diabetes, I see a lot of thyroid patients. Either you have underactive or overactive thyroid, as well as, for example, parathyroid is a hormone that controls your calcium. And if you have issues with that, it can cause osteoporosis. So I do see patients with parathyroid issue and osteoporosis as well. Most diabetes patients are managed by primary care doctor, but some diabetes patients, especially if you have type 1 diabetes or if you have type 2 diabetes, but you're on multiple medications or multiple insulin injections without showing significant improvement, then I think it's time to discuss with your primary care doctor to ask for a referral to see me. In addition, other difficult to control hormonal issues such as thyroid, adrenal, pituitary, which are relatively uncommon. I think you need at least a consultation with an endocrinologist to see if you need a long-term care with me or my partner. For a diabetes patient, being educated and able to self-manage their diabetes condition with minimum assistance from their doctors are really the goal. Especially if you're on insulin, you need to know how to adjust your dose independently. You need to know what are the danger signs if you're giving yourself too much or not enough insulin. You really need to know what your goal is, what your glucose number should be in the morning before you eat. And getting to learn that, it's something that is challenging. So you need a lot of support. And I think our center is equipped to do that with help with providers from a multiple discipline, not just doctor, but also nurse practitioners, nurse educators, and nutritionists. I did my medical school in University of Indonesia in Jakarta, and then I completed my residency training at Icahn School of Medicine at Mount Sinai at St. Luke's and Mount Sinai West Hospital in New York City. After 3 years of internal medicine training, I moved to Baltimore to do my endocrinology and diabetes fellowship. That's in the University of Maryland Medical Center in Baltimore.